We want to welcome you to the 2018 School of Social Work Young Alumni Insights panel. And we have an amazing panel of young alumni that I'm excited to introduce. My name is Caitlyn McLean-Meter. I work in the field department, and I am privileged to be your. So the goal of tonight is to provide an intimate setting for current students to hear from successful, recently graduated social workers. These alumni have experienced the transition from our social work program to their careers and are willing to share their professional stories and offer some career guidance, as well as to help you prepare for life after UB. It is possible, so those of you in the home stretch, take some confidence and insight from our young professionals. So we're thrilled to have such a talented alumni group with us tonight. So thank you all for joining us. I'm going to briefly introduce each of the panelists, and if you can give a little wave as I introduce you, that would be great. And I believe you also have a sheet that sort of gives you a bit about them as well. So Cassidy Connor is a 2016 graduate and currently a licensed social worker at Pathways Palliative Care. Emma Fabian is a 2014 graduate and currently is the Director of Substance Use Health Policy at Evergreen Health. Mark Ramos is a 2017 grad and currently is a Community Outreach Social Worker at the Center for Excellence for Alzheimer's Disease of Western New York. Caitlyn Shultz is also a 2017 grad and currently is a Psychiatric Care Manager at the Erie County Medical Center. Szprygada is a 2013 grad and currently is the Director of Education and Training at the Alzheimer's Association, and I have to add, an outside field educator for Planned Parenthood. So I'm going to get us started by asking our panelists to answer the following question, and then we'll open it up to you all for questions. So definitely be thinking about questions you want to ask the panel. So I'll ask you all, how did you get to the position you're in now, and what drew you to the particular field you're currently employed in?
All right, so I knew that I wanted to do actually hospice social work is what I was aiming to do. After I graduated, I purposefully took the summer off and really did not start job searching until to the end of summer, just to kind of give myself a break, which if you're able to do it financially, I strongly encourage you to do it. And it was actually the first job that I interviewed for, so it was just a bit of luck. I was just checking the hospice websites for Erie County and Niagara County, because Pathways is based in Niagara County. Saw the opening for their palliative care program, which if you don't know, for many people it's kind of the step before hospice. It's symptom management and quality of life. Interviewed and now fell in love with it because I get to do so much education about hospice in palliative care. What was the other question?
Yeah, I think you.
Oh, okay.
Thank you. I did the opposite. I started my job before graduation, but I knew I was interested in public health social work and health education. My second year field placement was doing reproductive health education and violence prevention. And then I found out there was a job opening at Planned Parenthood actually. So I interviewed in April, and they luckily held off until I was done with classes to be able to start. So I didn't take a break, but I do recommend if you can, it's helpful. I didn't take a break, and I wish that I could have, but I didn't want to let the opportunity go. But my first job was at Planned Parenthood doing health education and working with at-risk youth, working with teenagers, and I love the health education piece of it. And a prior field placement of volunteer work I had done was in dementia care. So my two loves were pretty much reproductive health and brain health. And so I learned of an opportunity opening up at the Alzheimer's Association, which I went to mostly because it had a little bit more of the blend of micro and macro social work that I was looking for at the time. So I was lucky enough to be able to work there, and now I do a lot of brain health education, as well as one-on-one social work with families who are impacted by dementia, which there's not a lot of dementia social workers, which is why I'm excited that there's 2 of us on the panel. But I absolutely love it. I worked with older adults through college in memory care facilities, and so I'm happy to be able to apply my social work stuff to it.
Hi, I'm Caitlyn. When I graduated, I knew that I wanted to work in a hospital. My first internship, or my second internship, I guess it would be, was at the VA, and I absolutely loved it there. So when I graduated, I knew that I wouldn't be able to get a job in a hospital until I got my license. So like Cassidy, I also had the luxury of being able to take some time off before I got a real person job. And I got my license exam, and then after that I just applied to every hospital in the area, and by some luck I ended up getting a job at ECMC in the psych unit, and I absolutely love it. I work with adults who generally are more aggressive, so it's a lot of de-escalation techniques, redirection, one-on-one counseling when applicable. I work with kids every now and then, but mainly adults.
So after I graduated from UB's MSW program, I worked in the domestic violence field for a couple years at a place called the Family Justice Center of Erie County. Yeah, kind of familiar with it, yeah. It's got a good reputation locally, and I really enjoyed it. I did learn in my couple years there that I didn't have the stamina or the energy or the skills necessarily for doing one-on-one counseling, which is what I found myself doing every day. So after working there for a couple years, I started to look around at other positions locally, and I saw that Evergreen Health was hiring. And I kind of knew in the back of my mind that Evergreen and some of the organizations that it's associated with had a reputation for being fairly edgy and doing some innovative programming in the community. So I kind of took a risk and leapt into something that was completely different to me, and started managing syringe exchange programs at Evergreen, and it has just turned into an incredible passion for me, and something I spend most of my time doing macro work. So I oversee some of our harm reduction programs and also do drug policy work locally, and I find it really fulfilling, and I think that it's helps me, I've always seen the need for social workers advocating for really quality service provision, but also at the same time taking the knowledge that we have about the populations that we serve and using it to change the way that society interacts with and treats people who have tended to be marginalized or traumatized or disenfranchised. So just have gotten lucky and ended up in a position that I think fits me pretty well.
All right, so I did a total 180 from when I previously started off going for my MSW here at UB in 2015. Prior to that, I had 8 years work experience in the human services field, working with at-risk children, either in the juvenile justice system or who were diagnosed with emotional disturbance and or another dual disorder. So I went into UB in the school to actually kind of get my license, because they really love these letters behind your name after. So I'm like, okay, so I'm gonna get, I'm gonna be Mark Ramos, LMSW, pick a school, pick an organization that works with at-risk youth. Well, when I over the summer, Zoe Costin, who I don't think she's no longer here. I think she left last year, right? She retired. So she came up to me, she called me up, and she said, well, the placement that we had for you, they're no longer available. So want to try ECMC? I'm like, does that have children? Not where we would place you. I'm like, I don't know. I don't know if this is something I really want to try. So I'm like, all right, well, I'll go and I'll do the interview and I'll see what I think. So after a year of that, being a social work intern at in the medical intensive care unit and the burn unit at ECMC, I decided that I actually liked working in the medical social work field. So those dreams that working with at-risk children at this point are put on hold because I really enjoy what I do. So my second field education placement was at the Jacobs Neurological Institute. So I worked at the Alzheimer's Disease and Memory Disorders Clinic over now at Conventus. It originally was at Buffalo General Hospital. And I worked with the social worker with individuals and families who were dealing with various neurological disorders. Multiple sclerosis, Parkinson's disease, Huntington's disease, and the big one was Alzheimer's disease and other dementias. So after a year of doing that field education in the clinic, I enjoyed it so much that they offered me a position on the other side, which isn't the clinic, it was on the outreach side. So I'm like, okay, so let me try this out. So what I currently do now is I work with the healthcare professionals and advocate for early detection, early screening, diagnosis, treatment, and care management for those who either have cognitive impairments, fear of cognitive impairments, or are actually diagnosed with Alzheimer's disease and or other dementias. So I went from being with, short story long, obviously. I went from working with at-risk children to now working with the elderly population. The thing is that this is more well-rounded for me. Like Julia, a fellow dementia social worker, it's very micro-macro oriented, so it's not just one or the other. It is very much, you have to make sure that you understand all the players that you are working with within my organization and then out within the community. So I think that I chose this because I know that not only can I make a difference within the healthcare professional field, but ultimately who it's actually helping are the individuals that each and every one of you will be working with once you are graduated in May or August, because I know some of you maybe are part-time. So.
Or next May.
Or next May. It will come.
Yes.
Thank you. What I heard from you, Mark, is that you should absolutely trust the field department. Is that right? Thank you all
In
for
my experience,
sharing.
yes.
Thank you all for sharing. And what I love about sort of your perspectives and really about social work in general is that everyone's path is so different and everyone's career goals and trajectory is so different. And people can come into the program thinking, absolutely, I want to be a school social worker, and then leave the program be on a totally different set of interests and course of action. So what else do we want to ask the panelists? Questions from the audience? Yeah, go ahead.
Can you go over the steps it takes to get your L?
Steps it takes to get your L.
Who's done it the most recently?
I did, I guess. I can.
Do you want the mic?
Sure. So, in order to get the L to your name, you have to take the exam.
And pay the money.
Right.
And pay the money.
Next
and
question.
wait a ton of
When
time.
you take the exam, how do you get the certification that you graduated? Like, can it be a little bit more informative?
Yep, you can submit your application. You send it to UB, I believe, in like the admissions, or I can't remember where it was, admissions. So you take it there, and you can take it there at any time, but it's not going to send it in until, I believe, your conferral date, which would be June. Mine was June 1st.
June 1st.
So I don't know if it's June 2nd for you guys.
Depends on when you
Whatever it might
graduate.
be. So yeah, it kind of depends where you graduate. So once they send that to New York State reviews it, and then you eventually get a notice saying that you are eligible to take the exam. So then when you get the notice that you're eligible to take the exam, you would then have to sign up to take the exam, and then you have to wait for another email that says you can sign up for the exam. So it's kind of a long, drawn-out process. I know I got mine probably July, saying that I was able to take the exam, and I wasn't able to take the actual exam until August 17th. So there was kind of a delay. It took a couple of months before I was actually able to take the exam, which was good. And I would highly recommend taking the class if you have the opportunity to, because it really helps you narrow down your focus as to what you should be studying, and it gives you a layout of the questions and what you need to know. So in my personal opinion, take the class. It's worth every penny.
To piggyback off of Caitlyn, whenever you get something new and accepted, like you send to the registrar your information, now it's there, you have the conferral date, now they have to have, you have that information, send it right back. I know a couple of my colleagues, they didn't, because they either didn't have the money or they were still thinking about it. It kind of sets you back, because especially in the Buffalo area, there are a lot of people who take the exam, but then there's only a few, there's a limited amount of slots to actually take each exam when they're offered. So that would probably be my best advice, is to try to get it as soon as possible. Unless, of course, you're trying to study, then, you know, get it to when you are more capable, or you feel you're more ready at that point. I got my information in June, mid-June, and by shortly after the 4th of July, I had my license. So it's all dependent on how quick you go with it, but you got to stay on top of it, or else it becomes a long, lengthy process. I actually have one of my friends who now they're in their 4th year, and they're like, well, I don't know if I want to do it. I don't know. I want to do it. I don't know I don't know how to do the paperwork. I don't want to send the paperwork. And now they're 4 years out of school. So now it makes it a little bit more difficult for them, because they don't have that great information that all you guys had through all of your classes. So I would just say, when the information comes, yeah, stay on top of it.
Well, I'll just say quickly, just so that you know what to expect when you go in to take an exam, because it's a little daunting going into the building. So it's a room that like just has a desk at it, and then they walk you in, and it's just all these different computers at like these little cubicles, because there's people in there taking exams not just for social work but all other licensing exams. I don't know about you guys, I definitely did not need all the time. They give you a lot of time to do the exam, and they give you a little it's like a laminated piece of paper with a dry erase marker to like take notes. Not that in our profession we would ever be doing like math or anything. I just used it. I went through like half the exam, and then I just gave myself like 5 minutes and just doodled, which you kind of need at that exam to like mentally take a break, I think, throughout it. So just a tip, I would plan for that.
Other questions? So following up on that question, how did you prepare for the exam? I know, Caitlyn, you mentioned taking the course offered by Szprygada and Denise and Catherine Kendall.
Yes.
Other tips in terms of preparing?
I remember I signed up for a bunch of email lists, like free email lists that would send you practice quizzes, practice tests, practice questions. I was getting those while I was still in school, just to like keep sharp, because not every question is going to be relevant to coursework that you took necessarily. It's very broad and very general. So it's going to be covering everything that could possibly have been taken by some social worker in New York State. So just to, kind of let you know what you don't know. But also the practice exams, even if you don't take the class. I didn't take the class, although I have heard that it's very helpful. I got a lot of the books from it. And I was lucky enough to know Denise Krause, and she gave me all the old books that she didn't use anymore because they were from previous years, and I just used all of the practice exams because a lot of the questions are similar. At least the context is similar. They update it obviously every year, but you get a good sense of the content that's on the exam by taking the practice quizzes. So that was the most helpful thing for me personally. And if you're a good test taker. Like, I feel like the stress is the biggest thing. If you feel more confident, then obviously you're going to do better.
Just to add on to Julia, there's also an app that you can download. I think there's like 500 questions in that. That's going to be helpful just for content mostly. As far as the questions and how they relate, the questions in the app don't really relate to how the questions are on the exam. So in the booklets, I would follow the books and take all of those questions. Also take breaks. Don't sit there and try to pound out 170 questions because you're gonna be fried. Take 5 minutes, 30 seconds, whatever you need to do, stand up, breathe, take your time. You will get through it, and it might be difficult, but we've done it. And if you fail it, do it again. It's not the end of the world.
Okay. So my best advice to give people is know your own true self. If you feel like the best way is to take the class here, take the class here. If you feel like the best way is through studying through notes or little index cards or reading the books or taking the practice tests, do what you feel is most comfortable. Because ultimately, you are here either 1 year for advanced students, 2 years for regular standing, or 3 years for part-time. So you guys have learned a lot of stuff, and it is a lot of stuff that you've learned, but still you know the basic principles. So I mean, my best advice to you is to know your own self, be confident that you know it, and yes, take a lot of breaks. And it's okay to fast forward and not answer the question. Go ahead and then come back to the question. It's a great little thing that they have during the test. So don't. I really didn't stress over it. I don't know why. I just kind of went into it knowing that I felt like I could do it, and I did. So if you feel like you're getting down, I know during the exam I felt like I was getting down a little bit. But then I didn't answer actually almost half the questions, and then I went back, and those questions started to become really easy. And I was like, oh, well, why wasn't I thinking that in the first place? So do what you think is best for you at that point. Take a breath and just find the best way to study that makes it more comfortable for you.
Yeah, that dry erase board could be helpful to write down the questions that you maybe had skipped to remember to go back to them, or like just be thinking about them because they might be relevant again in a future question. And also, it does help the closer you take the test to your graduation. Being out in the field is a little different than knowing what they want you to answer in the test. So that's true. I waited about 6 months before I took it, and that still wasn't very long. But the sooner you take it to graduation, if you can, again, if you can afford it, that's kind of a big thing. But if you can, schedule it sooner rather than later.
And if you're taking the little 10 question things on the app and are getting like 30%, don't worry, because like they said, the app, I only used the app to study, and then when things came up that I didn't know a lot about, or all the questions I got wrong, then I went back and like researched through my notes or just on my own to find the answer, and that was enough for me. But like even up to like me taking the test, I was still getting only like 30-40% on like the quiz one, so don't let that stress you out.
So I want to ask, what is the best thing that you feel like we can do to prepare ourselves for going into the job market that's manageable? Because I'm hearing a lot of like, do all of these things. And I'm like, I don't really have time for that because I'm like writing papers and stuff. And also I am chronically ill, so I'm like really kind of confined to like stuff I can do in more of like manageable space of time and like energy. So like, what do you feel like is like the highest priority in terms of like preparing yourself for getting into the job market and like starting to look for jobs, things like that, making yourself a good candidate?
Thanks. I really like that question. I don't know if I have an answer. I just like I should get the microphone because I love that question so much. I think a little bit. Is this your second year? You're a 2-year student, and this is your second year. So you're busy finishing up coursework and all that stuff, and thinking about employment, which is daunting, right? I like when colleagues or people who are interviewing for positions can talk about how they feel personally connected to the field of social work. And so if you can take some time to think about that as you're nearing graduation. You know, it's clear to me sometimes when people just apply for every job that they see on Craigslist or Indeed or Idealist or all those great job websites. Sometimes that's necessary because, you know, I think it was my father that always used to tell me it's easier to find the job that you want when you have a job, right? But at the same time, don't go into an interview like you're taking a test. Like those are two different skills. You know, we're talking about preparing for the test and then entering the job force. This is, you know, employers know that positions that require a social worker require, people to be willing to kind of engage in a labor of love. And if you can articulate your own narrative and how that applies to the field, you'll be light years ahead of other people that are coming out of social work school.
I guess know your limits. I know you said you had a lot going on, so just stay within. You have plenty of time still, just breathe, take your time. But if you're gonna focus on anything, resume, first thing, because that's the first thing you are judged on is your resume. Before they even get an interview or anything else, that piece of paper is all that they have. So I would get that down first. And then once you get an interview, just kind of research the company, get a little bit of background, and be genuine, be yourself, because employers are gonna see if you're being yourself or not.
Got it. And I would just say use your networks that you're building now. Use your field educator. I know you have a good one. I know you from the field education department. But honestly, I remember that's how I found my first job. I think on my field placement, we were sitting on coalitions. My field educator knew people. He knew my interests. He knew my strengths. You meet people here, like your peers here. The networks that you're building, that's a good place to start looking. Yes, focus on the resume. That's an important skill, and your interviewing skills. Those are things that you can just be thinking about. They're always going to ask you certain questions, times that you've solved problems. Start thinking about those things. But really, yeah, you do start to shine first on paper, so that's good. But if you're looking for place and I know I've seen you in the community at programs, so places where you have volunteered, listservs you can get on, organizations you're interested in. It's not that difficult to reach out to places, to get on listservs, to get on volunteer lists, find out what's going on. That'll often lead to just knowing what's open.
No one likes practicing for interviews and going through those questions, but I would say do it. I went through them so many times with just people asking me, because then I was so confident going into my interview, and to be honest, they really didn't ask any of those basic questions, but I think it just really helped my confidence knowing I had prepared answers. And in the social work field, yeah, they're looking for much more genuine, really about the work instead of what's your biggest weakness. What else was I gonna say? Oh, and it for me it was really scary being towards the end of my second year, and a lot of my friends already had jobs lined up, and so when it's approaching the end of September and you're still working at CVS on campus, it's it's the worst. But just hang in there.
Yeah, don't let that phase you.
Yeah.
Don't compare yourself against anyone else.
Yeah, don't compare yourself.
Here, I can walk it.
Okay, thanks.
So one thing that I have to say, and I actually have experienced it secondhand through two of the people that I actually graduated with last year, is don't take a job that you don't feel like you're going to be comfortable in. Just because there's job fairs that are coming through, or there's jobs and you think that you may not be able to get another job, what I have seen is that there is actually a couple people that have left social work altogether. One is working as a bouncer, and the other one is working at Geico right now, because they spent a month or two and they were so dismayed by what happened that they don't think that they can go back. So I'm not trying to scare all of you. I'm just giving you the realization that when you're applying for these jobs, just put yourself in the situation of what you're going to do and the job description, and see if it's something that you can do. Don't put yourself in a situation where you don't feel like you could be successful. All right. I like preaching about being with your passion and working with what you really like doing. Sometimes it's not feasible coming out. It really isn't. But don't sell yourself short. So for example, if you're going, I'm going to use an example, and no, I'm not saying anything bad about this organization, just using it as an example. So say Horizons comes in, because they seem to come in every year, and they have a whole bunch of different positions open, but you feel like you couldn't work with that particular clientele, and that's something that might not be for you. You don't necessarily have to apply for it just because. It kind of breaks me a little that these two who had so much potential as social workers are now so dismayed that they don't even want to be in the field anymore. So just giving you that heads up. So I'm sorry, Professor Cummings. I know I wanted to give him confidence, but I have to kind of build him up a little.
Thank you.
Other questions? And it can be a question for a specific individual on the panel about sort of their specific areas of practice.
Have any of you ever negotiated a salary, and if so, how did it go?
Oh, that's a good question.
Good question.
I have
We're so
not.
good at money, social
I
workers.
also have not.
Yes. When negotiating a salary, it's always good to kind of like research and see where it's at, whether you're entry level or you're in there after a year or you're there. Some organizations don't have much wiggle room for the type of maybe salary that you may or may not be looking for, just to give you that heads up. But having experience, knowing what your role is, if you got a position at a certain salary and then your role changes and you take on more things, that's something that you could talk about later on, whether it's 6 months in, whether it's a year in. If you're just interviewing, just starting the interview process, again, find out what it is. So like say you're going to ECMC, you find out what medical social work is and see if you can negotiate. I'll tell you most of the time you really can't because they have a set system, you know, sometimes with unions, this, that, or whatever. But it's always good to at least try. Be confident enough in yourself and your abilities that you can actually try to see where it is, and maybe it can happen. I mean, I did, and I did get that to work out, but this was after I was hired, and then I had to state what my abilities were and how they were different from when I started. So, did that answer your question? Okay.
I have a quick story, I guess.
Yeah.
I attempted to negotiate. I remember sitting in, my first boss out of graduate school, sitting in her office and talking about some increased responsibilities that she was expecting me to take on. And I said something along the lines of, then can we talk about a raise? And she looked at me and she said, why? She played hardball. And I have a lot of respect for her. And I didn't have a response formulated. And I ended up throughout that year getting a very slight raise. But I couldn't articulate why my strengths were an attribute or an asset to the organization at that point. I think in the long run, it wasn't the right position for me anyways, and I ended up moving on to a position that I didn't have to negotiate for a raise. But, I wasn't prepared, so you should be prepared for that.
Anyone else?
Yeah, just be prepared is very good. And just knowing the organization too, because kind of like Mark said, some organizations don't have the ability to do that. If it's a grant-funded position, ask about the grant, ask how secure it is, because you may be able to, and sometimes maybe you can't negotiate an increase right now, but they might have a procedure where in 6 months they re-review. So finding out the organization's procedures is also helpful if you're discussing it.
In an interview, how do you go about asking what the salary is, and when should you ask that?
Just personal experience. I think I asked at the end of my first interview, and the person who was interviewing me said, "Oh, that usually doesn't come up until later," and so maybe second interview, I guess. It was just the interview had happened. It was the end where she was like, "Do you have any questions for me?" And I said, "What is the general salary for this position?" And I mean, I've had jobs where that was fine and they answered it straightforward, and I've had jobs where they were a little taken aback. So I think it depends on the person. I've also, in my professional development seminar that I took when I was a student, that same question had been asked about negotiating salary to 2 different people, and one person said, I ask the person I'm interviewing what they think they should make, and if they undersell themselves, I won't hire them. And another person said, we're grant funded, you're gonna make what I say. And so it does depend. So I researched the organization. But I think it's a fair question, either second interview or the end of, I think it's a fair question personally to, if they ask you if you have any questions about the position, to ask during the first interview.
Oh, and I don't need it. Also, and I hope everybody can hear me, it's not only the salary that you should ask about, also ask about the benefits. Because sometimes, even if it's a lower salary, if the benefits are, if the benefits complement that in a way that it may be more beneficial than a higher salary, that's something that you may want to think about as well. So just to give you that heads up. So.
Julia, you mentioned professional development seminar. Is that, I'm new to the program, is that something the social work program offers or career development?
It was something the social work program offered 5 years ago.
Required.
It's required? Okay.
It's in the end of your second year.
Yep.
It's a short,
It's like a one credit.
one credit class, but it was
You have to be
great.
So yeah, I noticed I was like the biggest veteran here. I was like, wow, it's been like 5 years since I graduated. I don't know what's changed. But it's a one credit course. I think it meets for one semester,
Yeah.
at least it did. And it's about all this stuff. It's about interviewing, professionalism. And I know from what I understood, from what I heard from my colleagues, everyone's class is a little bit different. It's tailored a little bit different, but it is a requirement. So you'll take it.
Another question, yeah.
When you guys were applying for jobs and sending in all your stuff, what was like the average wait time before you heard back and the whole like process took as a whole? So like how long did you have to wait before you like heard anything back from them? And then when you did, like with all the interviews and if you actually did get the, hey, you're hired, like how long did that whole process go for?
For my first job outside of grad school, the process was quick. I don't remember how long it took for them to call me back, but it was less than 2 weeks. And we scheduled an interview and a second interview all pretty quickly. And I started, they waited for me to graduate. So that was pretty quick, but there were other organizations that I applied to that called me back after I had already started my other job. So I hate to give this answer, but I think it depends. It depends on their need, and it depends on what that organization is going through. But there were some that didn't call me back for like 2 or 3 months. But it's possible that they were interviewing other people and it didn't pan out, and so they went back to me, I'm assuming. But the one that did hire me, it all happened really quickly, within a few weeks.
Yeah, mine, I think I applied at the end of August, and they called me right away, like within a week, and interviewed like the next week. They offered me the job and canceled the second interview, and started at the end of September. It was very quick. For me, it was like less than a month from beginning to end.
Just from personal experience, I think I had some really bad experience. But of the jobs that I applied for that I got interviews, some of them were like a month or 2. It depends on the agency. I know ECMC, it took forever. But yeah, it really depends on the agency, the place, what their need is, how many people they're hiring. Unfortunately, there's really no good answer for that. But as far as like between the interview and an acceptance, I'd say about a week. That's probably a good ballpark.
Yeah, I think state, county, federal jobs, you're probably looking at hearing back in a while. That wasn't meant to be a political statement, but everything's slow in government. Or just a big institution. I mean, if one were to apply at a large institution like the University of Buffalo, might be a little while before you hear back. If you apply at a nonprofit that has 10 to 20 employees, it's probably going to be quite a bit sooner, and you shouldn't be afraid to reach out and ask. I don't know anybody that I think highly of that would look down on somebody that asked about, said, just a reminder, I sent in my application for this position, or after you went to your first interview, said something along the lines of, when do you expect to make a decision about this position? Advocate for yourself.
When would that follow-up be appropriate?
When would the follow-up about your application or your, their thoughts on the interview. You know, I think you should trust your instincts. I would follow up, you know, send a thank you letter the next day.
Yeah.
I think it's always, you know, it's always nice to hear that people enjoyed or were honored to have the opportunity to interview, something like that. And then, you know, I'm usually more apt to get on the, you know, respond to that person. What do you think?
Yeah, I agree with you. Send a thank you the next day, and it's appropriate to, you know, I think ask, you know, or just say looking forward to hearing from you. It might just make them move a little bit quicker. Definitely send a thank you.
I have a lot of questions, and mine won't be as good as yours.
Are there any aspects from this MSW program that you found are extremely helpful in your careers now?
Yes, self-care. I know that it gets pounded in your head in every class, and at the end of my studies, I was like, oh, self-care, I get it, I'm gonna do it, whatever. But no, it's so important, like incredibly important, even if it's just, you know, having a cupcake. Just take that time to just like breathe and enjoy it, and just, because you're gonna burn out fast if you don't do that.
I think field placement and the school itself, like the professors here that you know, like keep in touch with them. They make a big difference. You will notice like the skills that you're learning in each of your classes when you are doing your work. You'll say the social work buzzwords, you'll use the interventions. They always come up, but probably the biggest thing actually professionally in the field for me was field education experience and just like the people that I met and the networks that I made.
Yeah, I would say like the people that you meet in the program, I think those friendships are extremely important, especially when you're first starting out. It was nice that everyone was kind of in different places and searching for a job, then getting their job, and then freaking out and felt like they had no idea what they were doing. And so it's just really nice to have that kind of network, especially if you're in a job where you're the only social worker. When you're the only social worker, you need to maintain your peers from school to kind of get that support, because it's very different when you're in a room of nurses, which is my whole career, and then when I go to brunch with my friends from social work school, like you can just tell the difference in thinking.
Maintain in your head with trauma-informed care. I know that's something they also kind of, you know, put into your heads a little bit and keep pounding and pounding and pounding. But with regards to trauma-informed care, a lot of agencies, especially where I work with a lot of healthcare professionals, and trauma-informed care really isn't a thing. At all. It's not really a thing.
Oh yeah, people are obsessed with trauma-informed care where I work.
Really?
Oh yeah.
Okay, so I apologize.
They want to work with like neurologists and dementia.
Yeah, you want to work with
physicians?
neurologists and primary care providers, because that's where it's starting to be. That's where it's not happening at all.
Oh.
Okay, so come with us.
That's
and
interesting. Oh
take
no,
a
I
field
like
trip.
trauma-informed care.
Right? No,
and I like that it's
no.
talked about all the time.
But when you guys are just graduating, and the previous graduates also, I can't stress enough how much it is to advocate for trauma-informed care, because ultimately it comes down to helping out the individuals and the families who are dealing with whatever they're dealing with in whatever field you're in. And sometimes people that are not those individuals and not those families don't understand the dynamics, and that could be extremely it can be extreme detriment for those individuals and those families. And I see that a lot actually talking to, and I apologize, I will be more specific, with primary care physicians, and with actually some of the doctors that I saw, I'll call them out, at ECMC. Some of the doctors at ECMC, they weren't trauma informed. And the way that they worked with the individuals, worked with their patients, worked with the families, it became more of a detriment, and there was re-traumatization. So just I would strongly suggest maintaining that advocacy. Even if you don't always agree with everything that trauma-informed is. I'll be the first one. 2 years I was struggling with it. I was arguing back and forth with teachers about trauma-informed care. But I will say this, I am a now being in the position I'm in, I am an advocate for trauma-informed care, and I do talk to organizations about trauma-informed care and how that impacts the dynamic for the people that they help the most.
I'll just go off that really quick. I think, too, the whole notion of trauma-informed care is really helpful with advocating for yourself and what you're able to do in your job. Out there in the field, people still don't understand what social work is, and it becomes kind of a catch-all. And especially in my job, it's like I meet someone one time, and like for us, we're paid through insurance companies, so insurance companies like want me to undo and fix these problems that it's taken a lifetime to cultivate, and it's just not going to happen in one social work visit. And so especially having the words to use, things that go along with trauma-informed care, help to advocate for yourself so that you can really communicate what your role is and how much you can actually take on and handle.
Other questions? In the back?
So kind of going back to the interview process, and I know it's very individualized per company. After I graduate, I'm traveling for like a few weeks. Would you recommend that and holding off on applying until then? Or, because it is kind of intimidating when you hear your colleagues saying, oh, I've got jobs lined up. It's like, oh, great. So, I mean, would you recommend holding off until I get back, or would it be acceptable to apply for these jobs before I leave for a few weeks?
I mean, I think it's acceptable to apply before, but in terms of self-care, I would, in my personal opinion, take that time and just clear your head and enjoy your vacation and worry about jobs when you get back. I think that would be the best thing, at least for me personally. I don't know about you, but if you're taking a 3-week vacation, enjoy it, because you're probably never going to get that again. So enjoy it.
Yeah, you don't want to be obsessively checking your email for emails while you're on vacation. I would say hold off too.
Sorry, it's vegan. What was the weirdest or most intriguing question that you got asked during an interview?
What did I ask you? I interviewed Mark. He turned us down. I don't remember what I asked you though.
Wow, thanks, Jim.
You're doing real well.
Oh, I'll go. I think I was asked of how, something about like, how do you think your skills as a cashier at CVS would help you in this job, which I actually was prepared for, talking about patients and stuff, patients. Yeah, so, yeah, I would say if it's on your resume, think about that kind of connection, even if it's something as trivial as CVS.
I think for this was a field placement interview though. I think they asked me, would I rather view something from a helicopter or, so maybe you remember it? Yeah.
Aaron's and Anna's favorite question is to ask people if you could go on a tour of the Grand Canyon by helicopter or on the back of a donkey, which one would you choose? And they also asked me to tell them a joke.
So we had the same field educator, she and I, and those were questions that he asked us.
Very good.
What's the goal of those questions?
I believe it's your perspective. Do you see a big picture perspective or a nitty-gritty perspective? And the joke thing, I think, was just a culture, an organizational culture thing.
Yeah, they have very casual jokey.
So don't think too much about it. I guess just those kinds of questions are intended to actually just get at your personality and see if you are a good fit for the organization. And so just be genuine about it, because if you're not a good fit, you don't want to force yourself to be a good fit.
And I'll just have you know that Rachel, who's the executive director at the Alzheimer's Association, she said I had the best cover letter ever. I sent it to her. She actually
said that to me. Candidate. We wanted
it. So they do pay attention to cover letters. I will let you know that. So I know, if they say, present a cover letter with the resume, put a cover letter there. We're actually interviewing for an administrative assistant, a program assistant now at the center. And we requested that, and there are so many people that are just putting in the template that they get from Windows, which is great, but they're not putting anything about them. I'm all for, like, I personally, I like seeing people use the template, but then explain how it would be beneficial for the organization that you are trying to get hired at. So
Others do a lot. Like they can explain a lot. Especially like for me, when I applied for the Alzheimer's Association, my most recent work history was Planned Parenthood and health education at UB, and like working with developmental disabilities. I had worked with dementia, but it was many years prior, and so it didn't necessarily look like I was the most qualified, but a cover letter can clarify a lot of that stuff and show why you're a good candidate.
Is anyone currently, or does anyone get supervision hours for their C and just so how did you go about that? Did you ask in your interview if there was somebody there who could supervise that?
I don't have a social work supervisor.
We don't have an LCSW on our staff either, and I'm not a clinical person, but I have been in on interviews where somebody asked us if that was something that we offered, and I think that's a perfectly appropriate question to ask somebody if that's what you're looking for.
I got lucky with my position because we actually have a psychiatrist on our staffing, and psychiatrists are able to also fill in for an LCSW. So I am getting my contact hours through that. So.
Someone mentioned that they didn't expect to have a vacation anytime soon. Do you guys get vacation? Okay, good.
yes.
Yeah, my organization's really good about vacations and time off, and that's what Mark said, asked about the benefits.
Yeah.
And ask about organizational culture, because sometimes the benefits are written down, but sometimes your organization is more flexible. But yeah, no, I think we're all, it's an important piece of self-care.
Mm-hmm.
Don't let people scare you.
And if you have it, take it.
Yeah.
Like,
Use
take
it.
it. You sometimes you just need that mental health day. Take it, because if you don't, you're of no use to the if you're there and you're already your head's not in the game focused. Take it. I know it seems counterproductive, but you're helping individuals, you're helping families, you're helping whatever your organization asks of you. You're trying to help in that way. If your head's not into it, you can't do it. And I know it kind of stinks because I know I've been in positions prior to where I'm at now where, they tend to not want you to take off, but that is part of the self-care. Sometimes you just need to take off. I'm not saying abuse it. Don't say, oh yeah, great, okay. Mark from the young social work panel said that I could take off, so I'm going to take off once a week. No. If you need a day off, take it. That's what it's there for. Use it.
So I've heard you allude to a few challenges, and specifically I'm thinking about challenges relating to coworkers, maybe not even as much clients. Can you talk to sort of postgraduate challenges that you've encountered in your career so far?
A lot of my challenges have been about being, I'm the first one in my position. Pathways didn't have a social worker before me, and everyone that I work with and who's above me are all nurses. There's no other social workers besides the hospice social workers who are doing a totally different thing than I am. Luckily, my direct supervisor is very, open to social work, and I feel very valued, but I could see how you could easily fall into, when you don't have that other social work support, of being kind of like unvalued. So it's definitely something to ask about when you're interviewing, about who actually is above you, what other social work support is in the organization. I've had to find that outside of my organization, in the community, which I do a lot with connection to community resources. So just kind of in connecting my patients with people, I've found really great social workers that I know I can call whenever I have a question about something. So just something to think about, because I'm sure that happens more often than I'm thinking.
Yeah. I think I've been pretty lucky with coworkers. Even when I was the only social worker on staff, I did have good teams who like respected social workers and the skills. One of the conflicts I recognized in the organizations I've worked in is, your coworkers become a support system sometimes. Like I work with a lot of social workers, and we are each other's support system, and you become friends. But just being mindful that if there's room for a promotion or if for some reason you're not on the same level anymore, what that means, and just being mindful of that possibility and your priorities and your boundaries. And I'm not saying one way is better than the other, it's really a personal thing, but just be mindful of that consideration and relationships with your coworkers in that context.
Yes, relationships with coworkers is essential, especially in my work. I work with patients who are aggressive, and at times de-escalation techniques might only work so far, and not every patient is going to be receptive. So in that situation, I do kind of have to rely on my coworkers to kind of help me out and de-escalate the situation before it goes further. So just kind of know when you need to step back, and just having that relationship with your coworkers so they can step in that event.
That's good advice. I think that when it comes to working with colleagues in the field, one of the things that I realized shortly after graduate school was maybe I had this illusion that everybody who works in nonprofits or everybody that has been drawn to the healthcare field or human services in general is like out to change the world, and everybody's on the same page, and like being a good person looks the same to everyone. And I learned pretty quickly that it's certainly not that way. But like doing a good job looks different to different people, even if you're working for an organization that all has the same mission. So that's just been I think an ongoing lesson for me.
So it's really important, the networks that you have made now, the colleagues that you have met now, those friendships, those professional relationships that you've made, they're very useful when it comes to later on in utilizing them and talking to them when they're in a different organization or they're in a different, they're not working in your organization, because you can piggyback off of them and you can explain a concern or an issue that you're having at your organization, of course, confidentially, concerns, whatever, this, that. But it is beneficial to kind of get an understanding that that you're not alone in concerns that you're having at your workplace, and they may be having the same type. I helped create a group of like 6 or 7 people from last year. We try to meet once a month to kind of give like a recap of what's been going on and if there's any concerns and how we can help each other. And I feel like that's kind of beneficial because everybody has an understanding that there's no biases there. You can talk freely and not have to worry about maybe any vindictiveness or anything with regards to your coworkers. So I encourage you to maintain your relationships and your friendships with people who aren't working maybe in the same field as you or aren't working in the same organization as you, because they could be a good backdrop for you when you want to pull your hair out in situations. It's been really good talking to these 6 or 7 people once a month, meeting, going out, having non-alcoholic drinks, and just kind of figuring out where everybody's at so they can get a better understanding. That's all.
Emma made a point that just reminded me of something. So you said that a good job doesn't always look the same to people, and so just keeping that in mind with your boss. Because your relationship with your coworkers will be a support system, but your relationship with your boss will be a whole nother thing, which could be great, but that's also a very fair question to ask in your interview is what is your supervisory style? Because some people really need hands-on supervision, need some clear direction, need somebody to be telling them good job. Some supervisors are very hands-off, just expect you to be doing things, don't really give verbal feedback or whatever, or vice versa. That just goes back to making sure you're a good fit with that person, because you don't want to resent that job or hate that job because you're not getting along with your boss, because that makes a big difference.
Ling, did you have a question?
So I have two questions. One would be like, if right now, like currently you were not in this position, what are the kind of social work job you would like to try, or at which point you would change your career, like from the current position, I would say. And then the second one is, how different do you guys think that applying jobs like locally in Western New York and compared to applying in other cities or other states or international?
Okay. Having never left my job, because I'm still at it, so I've been at my job for a year and a half. I know that it's not a job that I can do for years and years, just because of the amount of travel. I have the entire, all of Niagara County that I have to drive around, and I live in Buffalo. So my career change is probably going to come less about the actual work and job I'm doing, and more about wanting to work closer to home and not do that amount of travel. I can't really speak to applying to jobs outside of Buffalo, because that's where that's the only places I applied.
Yeah. I kind of said from the beginning, my other area of interest besides dementia social work is reproductive health, gender violence. I volunteer for crisis services. I work for Planned Parenthood. I'm an outside field educator for Planned Parenthood. So I wasn't working doing the dementia care social work. I would probably be working in that field. Luckily, I get to kind of do both, because those are both of the areas that I've been interested in since I kind of started this journey. Although I do have a lot of interests. If I wasn't a social worker, I'd probably study meteorology. It's fascinating. Really is. And as far as applying outside of Western New York, same. I never wanted to leave Western New York. I love Buffalo, and so I've always wanted to work here. The furthest I've looked is like Rochester, but so I can't really speak to that too much.
I think the thing that I love the most about social work is it's so broad and you can go anywhere. So if you start to get burnt out working with kids, switch to adults, switch to geriatrics, adolescents, whatever. You can really go anywhere within social work, which is a great field to be in. As far as applying to other areas, I haven't really applied anywhere. I've looked into it just because, I can at this time in my life, and, maybe that's something that would be good for you. But just see where you're at, and if maybe you want to go to Florida just to get out of this snowy weather, go for it. But, yeah, it's up to you.
Yeah. I think the skills that we learn as social workers are scalable, and I think they're really needed in the world today. And so I'm lucky to love the job that I currently have. A lot of what I spend my time doing at the office during the day is public policy work, and I think those positions are few and far between in Buffalo. So sometimes I've looked at positions that might be based out of like New York City, where you work remotely from home or from elsewhere, which would be quite an adjustment for me. And so that's what, so I guess I'm just lucky that I currently love my job, because if I was gonna stay in public policy, those positions aren't usually at smaller nonprofits. But if you're looking at moving out of the area, I wish you the best of luck. It's not something I can speak to, but hopefully you can communicate with people wherever you're looking at moving before you start to apply for positions there. And also, you should look into what the licensure requirements are there, because if you sit for your exam in New York State, that doesn't automatically mean it's going to be accepted in other states.
Any final questions?
Somebody said that
Oh, I'm sorry.
Somebody said that you went right into your job, but did anyone get a temp license?
Temp license.
I didn't need a license to start my job when I started, so I got mine like 6 months after I started, so I didn't need one.
I've known of people that have gotten their temp license, and that was only because the position that they had gotten right before they graduated, they needed to have their license. So you need a supervisor to sign for that temp license. But I mean, if you can do it, just try to get your license right away. I mean, you still have to pay $90, I think, for the temp license. So it's kind of a waste of money if you're planning on getting it right away. But if you need it, it's useful. Yeah.
Yeah, final question.
So with several of us, I'm gonna make this like that.
Yeah.
So with several of us being like 67 days and 13 hours of graduation, I'm counting.
Nobody's counting.
What's something that you wish someone had told you in this, like where we are right now?
I would say just trust the knowledge that you have. Because you guys have learned so much over the year or 2 years that you've been here, and I know that in this moment you're like, oh my god, I don't know anything. But you do. Trust it.
I need to think.
I got this last year too. Cassidy told me, and then my awesome professional development seminar teacher also taught me. Ask questions. Ask questions, ask questions, ask questions, ask questions. The minute that you find something and you don't know what it means, or you don't know how to exactly do that, ask. Find somebody who does. Because I'm pretty sure also, if you ask that question, there are other people who also have that same question but are afraid to ask it. So ask, 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 and ask. And then the other part is, everybody who gets an education here, just piggybacking off of what you said, you do have that knowledge now. It may not look like it. If anybody's seen the original Karate Kid, I'm older, so whatever. If anybody's seen the original Karate Kid, I mean, it looked like he was just washing cars and painting houses and painting fences and this or that, but it actually turned that he was learning karate. Same thing here. So maybe you think that you're just, washing cars or painting fences or painting houses, but you're actually, once you actually go out into the field, that stuff that you learned is actually going to be applicable. So have faith in what you've learned and utilize that once you get out.
If I can just take like one worry from a lot of people that are in this room, looking really young, like 12 years old, has not been an issue at all. I was a BA MSW student, so I graduated and got my first job when I was 20. I graduated, 21. And so that was actually like my biggest fear going into working, is that people are going to look at me and be like, you don't know anything. And I do get you look like you're 16 a lot, but it has been so not an issue when I thought that was going to be a really big barrier in connecting with patients and families and getting like other people in the community to take me seriously. So I kind of wish someone would have told me that so I didn't stress out about it so much.
It has been an issue.
Oh, no.
But I will say that issue goes away the moment you start talking, as long as you keep your professionalism high. That's what has actually been told to me. It said, oh wow, you actually know a lot.
Yeah.
Or like, when I first saw you, I thought you were in high school. So like, once you actually show, like, speak eloquently, speak professionally, and be in charge, basically. Be confident. If you act like you know what you're doing, you feel like you know what you're doing, it makes a huge difference.
Anything that you want to add that you haven't had the opportunity to, or ask each other in the last few minutes?
Don't shy away from a job that has a lot of travel. I know that I can't do it forever, but because I have to drive really far, like way up to Barker and Olcott areas, and it's a lot of driving. But what I found is that I've really tried to turn those long car drives into self-care moments of, I started out listening to like social work podcasts and stuff as I was driving, and I do not do that anymore. I listen to fun podcasts or listen to music, and conscious about the fact that like this is me taking a mental break as I drive for an hour from patient to patient, and especially when you're you know, in-home visits that are really stressful, you need that time to decompress. So just, yeah. Anyone else?
Thank you, everybody.
Thank you all for being here. And thank you, Cassidy, Julia, Caitlyn,